Let's talk about the physiological effects of benzene poisoning. The benzene affects primarily the CNS and hematopoietic system. For the central nervous system's effects, it should be at very high concentrations. In this situation, benzene rapidly causes CNS depression, and at very high concentration, it may also can lead to death. Another one is hematologic effects. For hematologic effects, benzene can have adverse effects on 3 blood cell lines. Besides the 3 blood cell lines, benzene can also adverse effects on the pluripotent stem cells and lymphocytic cells. So these 2 different cells are the probably targets of the benzene toxicity. Caused by the benzene effects on the hematopoietic system, the patient may have anemia. So benzene-induced anemia is caused by chronic exposure. So this is chronic exposure, and this exposure with relatively high levels. It will not be like the CNS at a very high concentration, but it also should be high levels. And this term, it will be a long term. And if it is exposure for 5 to 15 years, benzene can also induce leukemia. And also this leukemia may persist by anemia. So anemia and leukemia are both the chronic exposure for benzene. Besides CNS and anemia, leukemia, benzene can also has other effects. For example, researchers find benzene has a relationship with tumors. These tumors are non-hematologic tumors, but the evidence is not enough to concern the relationship between them. In the animal models, benzene finds at very high exposure levels, it has a teratogenic effects. After we know the physical effects of the benzene, for the clinical evaluation, we have to know the patient's history and physical examination. We do the medical history and physical examination, we will know more about the patient. And for the symptoms, the clinical evaluation, including symptoms and the laboratory testing. For the symptoms, if it is acute exposure, it may cause CNS depression. For the chronic exposure, it may cause anemia and leukemia. These symptoms of the chronic benzene will be non-specific, so you may find the patient with fatigue, just like before the case. And we knew the symptoms, we will do more laboratory evaluation for the clinical evaluation. If it is hematologic abnormal, we can do the test about the CBC and plasma folate and vitamin B12 levels. And we also can do the bone marrow aspiration and biopsy. These are also useful in narrowing the differential diagnosis in some cases for the benzene poisoning. For the measurement, if we measure the blood and the breath, it's not clinically useful in non-occupational settings, because the non-occupational settings, the concentration or the levels of benzene will not be high. And also, if the benzene levels below 10, it will be very hard to do the measurement with urinal phenol concentrations. Now what should we do? So we can test the MCV and the lymphocyte count. This may aid in the diagnosis of the benzene toxicity. And we also can do the bone marrow aspiration and biopsy. This can be also identifying anemia. So for the case, until now, we knew the symptoms of the benzene poisoning and the clinical evaluation of the benzene poisoning. We will have to know what should be included in the problem list of the patient described in the case study. We can answer the first question. And the last, we will talk about the treatment and management for the benzene. If it is acute exposure, there's no antidote, because there's no antidote for the CNS treatment. We only can do the treatment for the supportive and the symptomatic. And for our chronic exposure, we also can't find the specific treatments for the benzene poisoning, because the chronic exposure result for the benzene poisoning is anemia or leukemia. So for the anemia patient and the leukemia patient caused by the benzene poisoning, we still can do the treatment for the normal anemia or leukemia. So for the patient with the chronic exposure, we have to do the same treatment for the anemia and or leukemia patients. We also know anemia or leukemia are very hard to do the treatment. So that is all for the benzene poisoning. Thank you.